Bilva, or Bale, this is another Ayurvedic medicine. And if you haven't noticed yet, Ayurveda was really good, is really good. Somehow they mapped all this stuff out thousands of years ago. Bilva, another good A1C lowering herb, not as good as some of the other ones. 5 grams a day lowered A1C by up to 0.6%. But in one study where it was combined with 20 grams of fenugreek, it lowered A1C by 1.9%. The only thing that did better than that in the research that I found was the Mediterranean diet leading to weight loss. So if you switch to Mediterranean diet and got some weight loss, then you would see this reduction in A1C. Bilva is a sacred plant in India. Its leaves have a sort of three-pronged segmentation, which is likened unto the trident of Shiva. And these leaves are frequently offered at temples to Shiva in India. Just kind of interesting cultural side point there. And some research has shown that it has a protective effect on the beta cells of the pancreas. The beta cells are the cells that produce insulin. And when someone is in progressively worsening type 2 diabetes, these beta cells are becoming fatigued. There's so much demand placed upon them that the stress and the demand on them can lead them to just die. And research is beginning to suggest that Bilva, also known as Bale, can prevent that from happening. Another one that's been shown to do that is Galega officinalis, or goat's rue, also known as French lilac. This is an old European herbal medicine for diabetes and was actually the inspiration for metformin. A molecule isolated from goat's rue was used as the starting point to create a synthetic molecule that had to be slightly different to be patented. Like, that's how the pharmacy world works. They can't be identical to a plant molecule. It's got to be altered some way in order to hold a patent. So this is one reason why we don't see pharmacological companies studying herbs and then releasing that information to the public, because they can't really make money on them like they can make on a synthetic product. But there are these programs within these pharmacological organizations like Eli Lilly and so forth, where they went and looked at indigenous medicinal practices that worked, and then they tried to isolate the active ingredient and use that as their starting point.